Welcome back. The efforts to defang Obamacare, they're everywhere. You got them on the federal level, where you still have some folks from the grand old party that are trying to repeal or defund it. Well, even some of the most conservative voices you can have, including none other than Tom Coburn, says people were wasting time here.
You cannot design a piece of legislation that will defund Obamacare. So the only effective way to truly stop Obamacare, and I think we ought to do it, to stop it would be totally reverse it. We don't have the votes to do that. But we do have the votes to delay it. But there's no way, according to the Congressional Research Service, that the vast majority of funding can be stopped unless you totally reverse the whole bill.
Okay, so that's in Washington. Now, on the state level, you got governors, some of which don't want to really participate with this. The Supreme Court ruled on Obamacare. You all remember what they said. States here, they can either opt out of the law's Medicaid expansion. That would leave each state's decision to participate in the hands of that state's governors and state leaders. Now, how did that all pan out? Here's how. 28 states, they're moving towards expansion. The shades that are in teal here, I like that teal, they are playing ball, and the shades, those shaded in red, said thanks but no thanks. The other colors indicate that the states are somewhere in between. Now, some say opting out makes no sense. Boston Globe, they recently penned a piece, and it's a scathing editorial, about non-participatory New Hampshire. And here's what they wrote in part. Refusing the Medicaid expansion makes little sense. The federal government picks up all the costs of the expansion initially, then 90% of them permanently. Hospitals, doctors would benefit from more insured patients. But many GOP governors and state legislators grasping for any way to make symbolic stands against President Obama, they've seized in the Supreme Court's ruling and turned down the money. So here's the question. Are Republican governors who are opting out putting politics above people? Richard?
No, this is the right thing to do. It's absolutely, Obamacare is cost too much. There aren't enough doctors to provide the care by throwing 40 more million people into healthcare. Although I wish everybody had healthcare, don't get me wrong, but this is not the way to go about it. In addition to that, when we talk about doctors accepting Medicaid, are you kidding? Medicaid? They don't want to do that. They don't even reimburse them at rates they want
Andrew,
to.
for time purposes, I will cede my time to you.
Okay, first of all, it's a health insurance program, so there aren't enough doctors. Hogwash. If everybody has insurance, everybody can get a doctor. Second of all, we don't know how much it costs because it hasn't been fully rolled out, but we know what it's saving people in New York. We know it's saving people in California. We know it's saving people in Oregon.
Saving lives or saving money?
Saving money, which in turn will save lives. And oh my goodness, what a horrible waste of money to keep people alive and keep them healthy.
Let me quote the famous Democrat Max Baucus. It's a train wreck. This implementation is a train wreck in every which way. It costs a ton of money, far more than anyone predicted. You can't implement this thing. I do transformation stuff in the private sector. So
if you were a governor, you would turn down the money?
In the private sector.
Let's deal with the question at hand. Yeah, if you were the governor, you would turn down the money.
Let's be fair. This money is not manna from heaven. This money is our money. It doesn't matter.
I'll ask the question again.
Yes, absolutely.
You would turn the money down.
Absolutely. This is how it works. And by the way, unfunded mandates in New York State. Do you know what those are? Those are federal mandates that were free at one time.
Don't use New York as an example because you're going to lose. New York, this is actually saving money in the state.
Point.
New York's unfunded mandates come from the federal government.
That's a great point.
This is not free money.
So
We always pay.
What are you going to do instead?
That's absolutely right.
What are you going to do instead? You're going to let healthcare costs continue to spiral out of control?
No, we go to a market-based solution.
Exactly.
The market has been the solution for the last 30 years, and it's not working.
Absolutely not. The government got involved in healthcare during World War II. It has been distorted by government for decades. We need a market-based solution.
First of all, before we get into merits of good or bad, if you're the governor of a state and you're turning down money to give your constituents health care that you'd have to go in your own pocket on, that is the definition of lunacy, whether you agree with it or not. Come on.
This is how it works. Here's your free money, Governor. 2 years from now, 3 years from now, it won't be free.
Okay, tell that to Jan Brewer, who is about as right-wing as you can get, and what she did in Arizona. She did the math, and she knew at the end of the day, she didn't want to be holding the bag.
At the end of the day, I think we'll be right.
History will judge. We're going to keep debating this one. We're going to fantasize after the break. If we did win, and none of us did here, otherwise they wouldn't be at the table here. If you did win the Mega Millions or whatever it is, what is it? The Powerball. Thank you here. How would you spend the money? Don't tell me about cars. We'll do something else. Andrew does health.